Ranking Member Senator Blumenthal for his opening remarks.
Thank you, Mr. Chairman, and I want to thank you, Senator Moran, for, again, bringing us together, for the bipartisan work that you and I have done together. This committee has been more bipartisan than any in the United States Senate, so far as I'm concerned, and it will continue to be so in championing measures like the PAC Act, which Secretary Collins, by the way, I just noticed, is not mentioned once in your written testimony, which mystifies me. Let me say at the very outset, I'd like to enter a few items into the record. The first is an article published this morning by ProPublica, supported by hard evidence and in-depth conversations with VA staff. It outlines a number of examples of real-life impacts to veterans caused by the firings, freezes, and cuts in this administration. It also outlines disturbing warnings of what's to come, documents with recommendation from DOGE, the DOGE tech boys, I call them the DOGE dopes, that outline cutting 100,000 employees and closing as many as 17 VA hospitals. I'd also like to enter into the record a statement from Darren J. Pettit, president of the AFG Local 0025. His statement is a summary of the dozens of impact statements from VA employees that were provided to my office this morning. And in addition, the New York Times article on mental health care, diminishing and degrading privacy available through telemental health care that is absolutely unacceptable. In Mr. Pettit's words, his statement represents, quote, the collective voices of frontline public servants who have endured significant and unjustified hardships stemming from recent policy changes, management decisions, and failures to honor basic labor protections. Finally, I want to submit for the record an updated list of 41 requests for information and 19 letters of inquiry that have been sent to this administration without substantive response, any sufficient response, or any response at all. If that is okay, Mr. Chairman, without objection.
Without objection, so ordered.
We're here about accountability, which so far has been totally lacking. The absence of responses to our inquiries are simply unacceptable. You inherited, Mr. Secretary, a VA that was delivering a record amount of health care. Last year, wait times decreased despite a record increase in new patient appointments. You claim the disability backlogs got worse, but the percentage of backlog claims actually is about the same, but increasing challenges in numbers. And the VA has decreased the time to process each claim, setting new records for productivity. You inherited a VA that was setting new records for burials, and that is important to the service members, the families that sadly have to provide those burials. The VA has been delivering more care, more services, more benefits to more veterans, and doing it faster than ever before when you took over. And that is in no way to deny the importance of improvement. Call it reform, call it revision. Improvement is absolutely necessary. But it shouldn't be done with a chainsaw. The head, the commander of the Veterans of Foreign Wars came before us, and he drew this analogy. When he was wounded in combat, the surgeon used a scalpel. He took the shrapnel out of his arm. He did not use a meat axe. He did not use a chainsaw. And that's the kind of improvement that we should work to achieve with the input of those skilled and dedicated caregivers who are working hard in the VA right now, a third of them veterans, thousands of them already fired, and others potentially losing their positions in the future. You've announced the cancellation of 800 contracts worth an alleged $2 billion, only to rescind that statement once the harmful impacts of the cancellations were made public, and we protested. You arbitrarily fired thousands of VA employees, including Veterans Crisis Line employees, only to subsequently reinstate a number of them after public backlash or after you learned that they were fired by mistake, and we protested. You've delayed the opening of facilities across the country, only to announce they'd open in phases because of insufficient staffing. You've equated them to restaurants. You claim that's how it's always been done, but that's not true. And so far as that 83,000 number is concerned, apparently you want to go back to the 2019 numbers, because since then, some 80,000 VA workers have been added to the rolls. You should know 2/3 of them are healthcare workers. If you slash those healthcare workers, VA quality and access will diminish. A number of them are VBA claims processors, a third of them. If you slash them, the times for PAC Act benefits will be delayed. I think that oversight is absolutely necessary and improvement is always possible, but it should be done positively without the slashing and trashing that right now you have advocated. In the real world, we know that support personnel are absolutely necessary. Answering the phones, cleaning the surgical equipment, preparing the operating rooms, scheduling the appointments, or fixing the IT systems. Those burdens will fall to others, or they will simply fall through the cracks if you slash and trash the VA. In Connecticut, the VA is operating without a locksmith because that position is not exempt from your hiring freeze. And the VA has ignored local requests for that exemption. There's no way for a VA facility to operate reliably and safely without good locks on the doors. Now, that position may seem like a minor or trivial one, but every member of the VA team is necessary to make the team effective and efficient. Now, we've already begun seeing the results and local impacts of staffing shortages. We've heard directly from veterans. My office has, colleagues have. Service lines at numerous VA hospitals and clinics have been reduced. Mammogram appointments have been postponed. Prosthetic employees have been fired and services reduced. The availability of VA operating rooms, as well as inpatient, recovery, emergency room, and long-term care beds have been reduced. Probationary staff in logistics and procurement have been fired, meaning critical medication and equipment deliveries have stalled. In some VA hospitals, senior and clinical staff are now helping stock supplies. Medical center employees who manage research grant applications have been fired, leaving hospitals unable to apply for new research funding. Countless employees are being driven away. You have 40,000 openings right now that you're recruiting to fill at the same time as you're firing 80,000. It makes no sense. How do you expect to recruit qualified, skilled, dedicated new workers, whether they're physicians or counselors, nurses, when you are firing probationary employees who are the future of the VA workforce or who have been promoted because they are performing with such excellence? nonsensical. So I think that you owe this committee some explanation. You have refused to do it so far in response to the 19 letters that I have written along with colleagues and the 21 other inquiries. There needs to be accountability. We need to avoid the potential disaster that is looming. And make no mistake, it is a disaster that is on the horizon, approaching us as surely as a thunderstorm in the nation's capital. And we need to avoid it. It will be a self-inflicted wound that disastrously affects all of our VA beneficiaries, whether they use health care or the PAC Act. And that is one reason why I have advanced the Putting Veterans First bill that would mandate rehiring all those fired VA employees and all the veterans who've been fired from the federal workforce in other agencies, give them the right to individual personal determinations, which should be their right under current law. We need to make the VA a place that works better for veterans and their families. They deserve nothing less. Thank you, Mr. Chairman.
Senator Blumenthal, thank you. Mr. Secretary?